Every Thursday, we're taking a look at a health concern or issue affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady from the John A. Burns School of Medicine joins us now with this week's topic, and we're talking about depression today.
Yes.
So what is depression? How do you define that?
Depression is a disorder which makes you sad. It robs you of your energy. You have trouble working, you have trouble studying, you have trouble doing tasks, and it lasts at least 2 weeks, but it can last far longer, 6 weeks, 3 months, a year. People suffer with depression because they're afraid of the stigma, bringing it to weakness of spirit. There are lots of symptoms of depression, and you see them on the screen now. It includes no enjoyment, hopelessness almost every day, sleeping either too much or too little, loss or gain of weight, no energy and fatigue, a feeling of guilt and worthlessness, being forgetful, and thoughts of death and suicide.
Are there any risk factors for depression?
There are. There are genetic risk factors, and even more commonly, there are family ties with depression. If it runs in a family, it increases the risk of family members having depression themselves. In addition to that, life stresses like a new job or loss of a job, a marriage or a divorce can cause a period of depression that lasts more than 2 weeks and longer. And of course, seasonal depression is common. We've heard of seasonal affective disorder, or SAD, at this time of year, and that's why we're doing this segment now. At Christmas and New Year's, a lot of people are having a blue Christmas, and that's very common as well. Then substance abuse is a real common trigger for depression. When we feel bad, a substance that's legal, which is alcohol, numbs our feelings, but it also makes depression worse. So alcohol and other substance abuse is another risk factor for depression.
What about medical or clinical depression? How common is that?
It's very common. 1 out of 5, 20% of all Americans have had a bout of clinical depression during their life.
Okay, when I say medical or clinical, a lot of people, like you say, have seasonal or maybe an event that happens that triggers it. But for medical or clinical, that's something that it doesn't necessarily have anything to do with something that has happened.
It may not.
Right, and it's just something that you have. A lot of people are like, why does that person have depression? They're not stressed, they're not sad, nothing happened, but that's why it's deemed medical or clinical?
Right,
okay.
And then society says, oh, a depressive patient, they're depressed because they're weak. They're weak in spirit. Something went wrong in their life. And in fact, it's a clinical disease like hypertension or diabetes. It's not something over which you have control. And because of that stigma associated with depression, Christine, people come to a doctor and they don't mention any of these signs from which they may be suffering. They instead say, you know, I have this chronic headache or chronic back pain or chronic pain of another type. They somatize, we call it. They make physical symptoms out of what really is symptoms of depression.
So how is depression diagnosed?
Well, a good talk with a patient and enough time to diagnose it is a good thing, but there is a screening test called the PQH-4 that many primary care physicians use in their practice, frequently having the patients fill this form out while they're in the waiting room waiting for the visit with the doctor. And if you have this, it's a very easy test to do. It's very simple in lay language, and the doctor can screen for depression and know who to explore depression further with or who to refer.
And if you are diagnosed with depression, what are some of the treatments available?
Well, psychotherapy, or therapy with a therapist, and it doesn't have to be a psychiatrist, it can be a psychologist, it can be a minister, it can be a social worker, is very effective, but it usually takes several weeks to become effective, 8 to 10 weeks to become maximally effective. But it does work. And then that, either alone or in combination with medications like the ones you're holding right now, these medications alter brain chemistry, and they basically can affect the problems that cause depression in your brain. And they take about 2 weeks to begin to work, get a maximal effect in about 6 to 8 weeks. The beauty of medications, Christine, is that if you're fatigued with your depression, they can give you a medicine that increases your energy level. If you have trouble sleeping with depression, you can take a medication that treats depression, but also treats your sleep disorder as well. And if you're anxious with depression, which is very common, you can have a depressive medication that helps with anxiety.
Okay, so there are medicines that help all these different kind of ailments that might come with depression.
Absolutely.
Okay, all right. And next week you'll be back?
Yes, but the real key with depression is you're not alone. There is help. There is a cure with appropriate treatment.
And don't be embarrassed or ashamed to get the treatment.
That's right.
Okay.
So next week, we're going to talk about a common problem that leads to many questions here, and that is leg cramps.
Leg cramps. We get it every week on Wake Up Today, right?
Chronic nocturnal cramps.
I'm glad we're talking about it. Thank you for stopping by, Dr.
You're
Brady.
welcome.